Hello, this is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine. If you're receiving this message, it's because you are one of our Regenexx or Regenerative Medicine treatment patients. I wanted to reach out because with all of the sort of public health concerns associated with coronavirus and COVID-19, I think it's important if we are connecting with you to really directly message things that are relevant to your health and condition so that we can clarify any issues that may be there or clarify any concerns that you may have. So first and foremost, understand that we're here to help. And if there's anything relevant to what we're treating in your case, understand that you can call, email, or digitally connect with us in any way so that we can help you out wherever possible. Number two, if you are a patient that has an upcoming procedure, that procedure is still scheduled and it's okay to proceed with. I want to give you some details in that regard, however. Number one, understand that we are doing everything we can to maintain a sterile, low-risk environment to limit any risk of exposure that you would have to the coronavirus. How are we doing that? Number one, we are obsessive when it comes to cleaning the office as it is. We are even more so about that under the current circumstances. Number two, we are significantly limiting who's actually coming through the office. That's important because that means you have a lower risk of being exposed to someone who could be sick with the coronavirus. We're doing that in the following ways. To begin with, we're doing most of our follow-ups and new evaluations via telehealth, which means they're not actually coming to the office. In addition, when it comes to staff, we're actually rotating people out so that people are not spending as much time in the office at one time. I think that's helpful just to reduce the overall risk to everyone in terms of being exposed to the coronavirus. In addition, I think it allows existing staff to reduce their overall sort of exposure to the negativity and pressure and stress with what's in the environment right now. In addition, we are following all current guidelines, all right? So current guidelines say that we are okay to go ahead and proceed with these procedures. Understand that this is a fast-moving environment right now, which means that I have colleagues that are at the front lines of this in the hospital, and if we start to get word from health authorities that we actually need to give up our supplies of things like masks and gloves and gowns, under those circumstances, then we would actually have to cancel your procedure. But until that happens, we are still fully operational and will be able to proceed with your treatment. Other things to keep in mind. So if you are currently post-procedure or plan for procedure and physical therapy is part of your regimen, which it should be for just about everyone, that will probably be challenging in terms of in-office physical therapy, since I think pretty much all of them are currently shut down in that regard. There are some options for tele-physical therapy. We're working on some arrangements for patients. You will get that information, either part of this message in terms of connected or attached to this message. We'll give you the names of one or two options of organizations and people who we think will do a good job. Definitely consider doing that. For starters, it'll help with your actual joint, tendon, back issue that we're treating. Number two, I think it's so important to stay physically active. And if you're really quarantined, stuck at home, and you're not able to do that, I think anything you can do to get more physical activity is important for not only your health, your musculoskeletal condition, but even just overall mental well-being and attitude. So please definitely do that. Lastly, again, if there's any issues, any problems, feel free to call, email, set up a telehealth appointment. We are here to help in these kind of times where things are getting a bit panicked and chaotic and confusing. We're here to really help you guys out in any way possible that we can help. In particular, if it's related to the condition that we're treating for you. I hope you're doing well. Please stay safe and healthy. Any questions, again, contact us at your convenience. Have a good day and live well. Bye-bye.